Yeah, do you see the red light there?
Yeah.
Good. So we're starting a new technique that has few names. And to make things complicated even, other names may mean something different or same thing. So the name of that technique shortly called trigger point. And you can find it under other name as tender point, as myofascial tension or trigger point. So that would be, and maybe there are other names, but I'll try to make a bit of sense to what is trigger point, what is tender point. A lot of the time I don't see a huge difference between these, but sometimes it's quite theoretical to know what's the difference between. Most important is really how to treat it. Yeah? Okay. So on the muscles, connective tissue, fascia, tender, ligament, tendon, whatever, there are few places that I'm sure that you recognize that once you're pressing that you feel either there is objective or subjective finding. Like objective finding would be that you feel hard. It's objective because it comes from you, from your palpation. Either it's tense or hard, or you see a spasm coming from the muscle. Have you ever had it from a client?
With Adrian, was it Adrian?
Yeah.
It was really
There is a spasm. Yeah. And other situation would be that the client respond. They say, ow, or it's painful, or it's tender. Okay? So that technique now related to that problem. Now, why does it happen? Why do you have tender point in muscles? What's inside? Long? You just have your anatomy exam. So it's not in the anatomy exam. Few things happen. First of all, there can be a chemical problem there. Let's say if you have a bit of waste product accumulation, anything that you aggravate the muscle and usually would just feel like a pressure, now the muscle's nerve system feels that is even more. It's like people. If you aggravate someone just by pushing them and they are relaxed, they would say, hey, what are you doing? You know? But if someone is already upset and you do it, oh my God, right? So same with muscles. Sometimes this palpation that we do, you checking to see what's going on there. And if there is chemical irritation, adding your pressure may cause pain or discomfort, okay? So that's one way. Another way is that to think about why we're probing is that the muscles might be tense because of a nerve supply. So the nerve supply from the brain just create a tension. And with the tension, it's already irritated. And you're adding a bit of pressure and they say like, oh, you know, that's it. They lost it. So the first one was due to chemical problem. The second one is due to neurological spasm issue, yeah, tension of the muscle. Now, is it really matter if it's this one, that? Sometimes you don't know. I mean, most time you really don't know. But it's just theory behind, so we can kind of understand why sometimes when you press it, it's quite tender, and sometimes it's not. In any rate, when you're pressing and it's tender, there is an issue there. Usually, to your normal pressure, it should not be painful, right? And you know when you're finding it around shoulder or lower back or sometimes hip or sometimes there, depends on the consultation, you end up with understanding what the problem is because of overuse or underuse or injury. Questions so far? Okay. Now, what's the difference between a tender point and a trigger point? Tender point is a point that you press that is just tender. means painful. Trigger point, the same pressure would create a referred pain. Okay?
Always.
No, not always, but sometimes. So trigger point, so we talked so far about the difference between tender point and trigger point. Tender point is local. Trigger point, referred pain. But there are two types of trigger point, active and non-active trigger point. So when a trigger point is active, when you do pressure here, it sends kind of a radiating pain. We'll talk soon why. But an inactive one wouldn't do that. So what's the difference between tender point and inactive trigger point? Let's not go there, okay? It's, each one, if you want, go to the book, and I don't, for me it doesn't make much sense, the difference, and I don't care much about it. But what I care is if there is a referred pain that is more severe to happen. Now, why does it happen? Why when you're pressing on one muscle there might be a trigger point going? Is it a nerve pain? Is it that you're pressing on a nerve? The answer is simply no. Sometimes there is a referred pain. As you remember sciatica, there is a pressure on the nerve here. Maybe the camera can come a little bit closer. So the pressure in the nerve or on the lower back because of disc or something else, and then there is a referred pain. This is a nerve referred pain. However, there are a lot of muscles referred pain. For example, if you have pain here on the quadratus lumbarum, there might be a referred pain to here. Why? Because we don't think about it this way, but sometimes the human body is not that great and specifically tells you where the problem is. I'll give you a few examples. For example, sometimes neck pain, you feel it as a headache. Another example would be heart problem. You can feel it on the left side, left arm, left chest. Sometimes it goes to the left jaw as well. So the body is not great in telling you exactly. It tells you pain, 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 and sometimes you don't know exactly where the pain is coming from. So same thing here. Imagine, I don't know, gluteus medius, and that area, they might go, the sensory nerves might go to the same area in the brain. And the brain can't exactly feel, is it this way or that? Is it here or that? So sometimes it confuse, or it's not specific enough to tell you where the pain is. So that happens. That happens quite a lot, that pain is not exactly localized. Yeah. Same with abdominal pain, pancreas pain, kidney pain. Sometimes you feel it here, and actually the problem is there and opposite. Yeah. Just be aware of it. Okay. So what do we learn so far? When we press on the muscles or any connective tissue, we could have tenderness or trigger points related to some chemical problem in the muscle when it's tight, or the nerve is irritated due to continuous tension there. And when we press on, it sends a signal of tenderness and pain. Sometimes this local problem would be referring pain, which means it's a trigger point, active trigger point. Sometimes it would not. Okay? Now, the way to treat it is very much similar to what we've done so far by same technique, like remember compression or finger kneading, or sometimes you need to use the elbow, but trigger point therapy is nothing new. There is nothing new there. Sometimes you can go cross fiber, sometimes you can go along with the fiber, sometimes you go circles, but it's the same old thing. Slowly get in, stay, talk to the client, see how it is, let them breathe, and then ease off. Few effleurages, relax them, and then try it again. Okay? Shall we do that? Okay, so let's break this